I think one of my favorite things about RCSI is the small group teaching aspect of it. Medicine is a very intricate field that requires a lot of deep studying, and so being able to do this in a small group setting where you're given personal attention from a lot of the GP tutors and professors is a very good way of being able to be involved in this manner of studying. I think the small group teaching aspect of RCSI translates very well when we get into our later clinical years and when we do rotations and placements in hospital.
Our class, I think, is about 80 or so people, which is great because you really get to know your colleagues, and not only that, you get to know the faculty, the teachers, the professors, which for me was really important when choosing a medical school because it's that direct contact, and for me that's how I learn best.
Just having a smaller class size means you get to develop close connections with both your colleagues and the teaching staff here at RCSI, and it allows people to develop your communication skills and just foster teamwork when we're discussing patient scenarios or how we would manage patient conditions.
During both first year and second year in the GEM programme, you have weekly tutorials facilitated by current doctors. So in first year it was mainly GPs facilitating, and we have a case of the week and you discuss all of the elements of the case. So the presenting complaint, the diagnostic process, and then treatment. And this small group teaching really gives you an opportunity to enhance your learning and to kind of cement the things that you're learning in lectures through this kind of discourse, and really gives you an opportunity to check in on your learning by not just sitting there in a lecture and taking notes, but actually discussing the topic with your peers and with a tutor.
Tutorial groups have been a lot of fun. You have around 8 to 11 people in your group and you cycle out an investigator who's with you. So you get to learn from different doctors or physicians, and you're given different cases or cases of the week, and you with your colleagues and the investigator get to determine how you get down to a diagnosis, for example. And that's all hands-on. People are asking questions. You're not shamed. You are encouraged to get things wrong. I think that's a very positive environment in which to learn.